Hello, everyone. Welcome back to our People Power Health interview series. Today, we have a very special guest, and we are very grateful for the opportunity of having this chat with Dr. Alister Martin. Doctor, how are you?
I'm good. Thank you very much, Sam.
So basically, what we normally do when we are starting these interviews is, first of all, we ask our guest, how would you introduce yourself? If you get into a room full of new people that you haven't met before, how would you introduce yourself?
Yep. I'm Alister Martin, an ER physician, organizer, and policy entrepreneur, and it's great to be here, Sam.
Amazing. So my first question, Mr. is, when did you recall that you first started to get interested in healthcare, in medicine? How did that came? It was with your family, some friends, some event that happened?
Yeah. So for me, my experience getting involved in medicine starts with my mom. And when I was a young kid, my dad left our family when I was fairly young. And after he left, my mom really had to put the team on her back and provide stability and guidance for me in just a transformative way. And I quite frankly didn't know how hard she was working. I don't, what kid ever really does appreciate the lengths their parents go. But I think for me, one of the critical moments where I saw the sacrifices she was making and how hard she was working was actually when she got cancer. She had metastatic cancer and had been really sick. I saw her progressively losing weight, losing her hair, losing energy. And over time, as she got chemotherapy and radiation, these treatments, which were ostensibly making her better, were also, to me, it looked like making her sicker. But through it all, through the treatments, through the medications, through the hospitalizations, she was working 2 jobs. And there was a time in which she, as we like to say in emergency medicine, she like skimmed the trees, like she was gonna crash, we were gonna lose her. And I'll never forget, someone who she was dating at the time was on the phone with someone else. This person didn't know that I was next door, in the room next door. And I overheard him on the phone ask, where does he go when his mom dies? And that to me was the first moment that I think really understood the gravity of the situation. And I also understood that my mom had for so long in the illness been working and trying to maintain this facade of stability and peace for me. But less hearing those words for me really brought to bear this vision, this idea, this reality that I could lose my mom, And so I think I stayed there for a pretty long time, Sam. I think I was pretty depressed. And as a kid of a single parent, I think one of the things that you learn early on is to not make trouble for your parent because they're working so hard. And I saw that talking about her illness was something that made her more sad and upset. So we never talked about how bad things had gotten. And so in my mind, Sam, I think I just assumed that I was going to lose my mom. Like that it was just going to be an eventuality. And the doctors that brought my mom back to me, that did the mastectomy and did the radiation chemotherapy, these doctors were like heroes to me. So it was those experiences, the seeing of what the field of medicine can do when it's working at its best, that inspired me to plant the seed of hope of becoming a doctor.
Amazing. Thank you. Thank you, Alister, for sharing that. And now that you mentioned that seed of hope that can be seen clearly when medicine is done in the right way, my next question for you is, as you went into medical school and as you went into emergency medicine, how have you seen that medicine has been progressing in the last few years? Is medicine still this space can provide hope for people, or have there been any challenges in the field of healthcare and medicine?
Yeah, I think that medicine is at its core a hopeful science. I think that when harnessed in its most pure form, it is the taking care of people when they can't take care of themselves. Rudolf Virchow said that a physician is the natural attorney of the poor. And I believe that. I think that the medical system, however, over the course of the last several years, you can go back a couple decades, has increasingly been motivated and contorted by the financial drivers of health, the commodification of health, the incentivization of doing more rather than doing better for people. And so I think that we've certainly lost our way, but I do have hope that through advocacy, through organizing, and through leadership, people exercising leadership at all levels, not just CEOs or formal authority figures, but everyday rank and file nurses and physicians and doctors and social workers and students. We can't forget the next generation. I think that through everyone exercising leadership together, we can right the ship.
Okay, when we hear you right now, it's very clear for anyone to hear you that you are fully convinced that this is possible and that organizing and advocacy is the way in which medicine can find its way again to be in this hopeful space for people. But was that always the case, or was there something along the way that made you find and believe again that there was something that could be done and that organizing could be a tool to achieve that?
Yeah, I think that coming from where I came from, Sam, in my community, which is a low-income majority minority community in New Jersey, I didn't have many examples or models of people who had become doctors. Very few students every year even went on to graduate from a four-year university. And so the odds were pretty steep for me to achieve that dream that I shared earlier of becoming a doctor, like the ones that saved my life, my mom's life. The result of not having many models or examples of what it meant to be a doctor was that when it actually came time for me to step foot into a hospital, I'd never actually stepped foot into a hospital on the side of a clinician or a healthcare worker. I just didn't have the exposure. And so when I was a third-year medical student at Harvard, it was my first experience really seeing, quite frankly, the everyday violence of poverty and seeing how the healthcare system chews poor people up and spits them out. And actually, quite frankly, also chews healthcare workers out and often takes advantage of their grace and takes advantage of their willingness to go the extra mile for their patients. But it was seeing the constant examples of inequity and unfairness perpetuated by the healthcare system that triggered me to go and try and figure out if I could come back with some solutions. So I had to leave. I made a decision to leave medical school training for 2 years, and I went to the Harvard Kennedy School of Government. I think at that time I would have said that I was going to learn more answers, but I think actually what I came back with was how to ask the right questions,
okay,
and how to begin doing the work of unraveling the mess that we're in.
I love that. I love how asking the right questions is sometimes the pathway that can take us to the next level.
That's right.
Thank you for sharing that. Okay, now let's start to move on and start to talk a little bit more about some of the activism and some of the activities that you have been doing in recent years, because you are a very powerful voice, right? Very powerful voice. And I want to ask you that if from the different topics and the different areas where you have been active and being a powerful voice about, is there any particular topic, any particular arena that you would like to share with us today? There are several projects that you have been involved with, but is there any one of them that has a special space in your mind, in your heart right now?
Yeah, absolutely. I'm motivated by the question, why is it in this country that we have over 60 million people who are eligible to vote, but not registered to vote, right? That number, 60 million, is more than the total population of the country of Spain.
Yes.
And if I were to really interrogate why our healthcare system is the way it is, the more I ask, what's going on here, the more my answers drive me back to this sort of genesis fact, which is that our electorate, the people who are voting, they don't represent the full public, right, in this country. It's missing, our electorate is missing a huge chunk of voices. And I'm a practitioner of a form of leadership called adaptive leadership, which is taught by Ronald Heifetz at the Kennedy School. And one of the things that we learn in that framework is that the perspective that you are missing is often the perspective that will bring your movement or your program or your intervention to its knees. It's this willful ignorance, the not hearing of a certain perspective, this fear of what this perspective could mean, that actually cripples an intervention or cripples a policy or program. I think that's what's happening in this country. We have so many people who are not at the table helping to decide what the laws, the rules, the policies of this country will be. And because they're not helping to decide those policies and laws, the laws that actually end up being passed don't serve them. And so we see on a nightly basis in ERs like mine, patients who are coming in because of homelessness, or they need a work note, or they haven't eaten in 2 days. If we had a fair set of policies and laws, I think that those patients would be taken much better care of. And so I think that what we must be committed to doing is helping as many people as possible into our democracy, really bringing folks in and helping to expand our electorate.
Now that you mentioned that, like, I have never heard that number, 60 million people eligible but not registered to vote. And I know that there have been several efforts and several projects so that people know that they are eligible and they can get registered to vote. And we are not talking here about a specific political party or anything of that, just that people are registered so that they can be part of democracy. Is there any, for example, people that are listening to this interview and that they want to get involved in their communities? Is there any particular way in which they can help in this need?
Yeah, absolutely. So again, the problem is that there are so many Americans in this country who are eligible to vote but not registered. Many of those folks are sitting in our waiting rooms in healthcare facilities all across this country, in ERs and community health centers and federally qualified health clinics. And healthcare providers can be incredible conduits or messengers of the importance of civic health, of the importance of voting. And so what we do with our organization, Vote ER, is we make it really easy for healthcare providers to bring their patients in to the electorate. It's a nonpartisan tool called the Healthy Democracy Kit. Basically, we have lanyards that physicians wear. Patients will often ask, "Doctor, why does your lanyard say vote on it?" And we have our physicians say, or nurses or PAs say, it says vote on it because I want you to take 30 seconds right now and check your voter registration. We have about 50,000 of these spread all across the country. Healthcare workers like medical students, nurses, PAs, physicians are all using those on a daily basis to help register their patients to vote. We've helped over 80,000 people across the country register to vote, and 85% of them actually go and turn out on election day, which is an astronomically high number. So if folks want to get involved, they can go to vot-er.org/kit and get a free kit and help register the patients today.
That's amazing. That's amazing. And I am sure that a lot of people that are listening to this interview will go immediately to the website and start getting to know more about these kits and these opportunities that you give patients from the ER room so that they can get registered and be part of democracy. Now, let's continue talking a little bit about some of the activities and the activism that you have been doing. You have been also active in social media, right? And you share through different channels about the importance of being active, of being part of that change that we want to see in the world. So was this activism something that you always had in your mind, or is something that has been becoming more visible in the last few years?
Yeah, I think just to start with the concept of social media as a form of activism, I think it is It is a necessary but not sufficient way to engage in advocacy and activism nowadays. If there's one thing that I can share for the listeners, is that your tweets are not enough. Your posts on LinkedIn are not enough. Your Instagram reshares are not enough. It's a good start to be engaged in digital advocacy and sharing the word and making sure that your voice is heard digitally, but don't stop there. Organize in your communities, learn how to mobilize folks in your departments, in your medical schools, in your hospitals, and pick an issue. It doesn't matter which one. Take a look around. There are so many now. Every other day, there's some big screaming headline about the backsliding of this country. And we need your voices now more than ever in this country. For me, the way I think about my activism is actually in two very different domains. The first is grassroots activism, and that's mobilizing lots and lots of people to take individual action. We do that through Vote ER, where I mentioned we have over 50,000 healthcare providers out there registering their patients to vote, through Get Wavered, which is an organization that's helping to change the ER into the front door for addiction recovery, where we've mobilized over 10,000 ER physicians, through our work with GOT Vax, which is Get Out the Vaccine, which is using Get Out the Vote tactics to help patients get vaccinated in low-income communities. So those are some examples of grassroots activism. But the other domain for me is grass tops activism, actually working in government. I just wrapped up a role working as a senior advisor in the White House, finished that role back in November of 2022. I've worked for governors before and Congress people in the past. And I think it's important to understand how to pull the levers of change at both the federal, the state, and local government, because you can get pretty far with grassroots activism, but I do believe that you've got to be able to channel the energy you've built in the grassroots space into long-term change in terms of policy. It's a way of almost freezing into place the energy, the feelings of the people that you've been able to mobilize. And I think you've got to be able to do both.
Thank you. So a couple of last questions before we need to wrap up this interview. So first of all, if you had the opportunity of meeting with anyone from across history to grab a cup of coffee and to have a conversation, nice chat, who will that figure be? Who will that person be? Anyone from all across the history of the world. Who will that be and why?
I think I'd like to speak to my dad again.
Okay.
As I mentioned at the beginning, my dad died when I was my dad left our family when I was very young. I was about 4 years old. And I met him again for the first time when I was 20. And we didn't have a really good conversation, let's just say that. But I was offered the opportunity to, several years later when I was 25, to be with him in the last couple of weeks of his life as he was dying from cancer. And I had a decision to make. Do I go and be with this person who wasn't there for my mom or do I set my pain aside and be there for this person? And I did. I went, and it was the most important thing I've ever done. And I learned that my dad was an organizer at heart. He had gone to the Harvard Kennedy School. He was the ambassador for his country in Belize and worked at the United Nations. And he spent his life organizing on behalf of poor people in Belize. And I think as I've gotten older, I've watched lots of video interviews of my dad and read his writing. And what's interesting is as I've gotten older, I realized that many of the lessons that I'm learning now in my organizing efforts are things that he knew, that he had experienced. And I think we'd have a much, much more interesting set of conversations now, and be interesting to check back in on how I'm developing and some of the lessons that he learned in his journey.
Thank you. Thank you, Alister. Second question. Is there any book or movie or some kind of media that you will recommend people to watch? Is there any media, any sort of literature that you will recommend people to watch if they want to get involved in organizing our activism?
Really good question. Yeah, I think the best book that I would recommend is a book called Leadership on the Line by Ronald Heifetz. This is a book that I mentioned a little bit, a framework that I mentioned a little bit ago. The adaptive leadership framework is all about the improvisational nature of leadership and the idea that leadership is a dance. You don't necessarily know what the next move is going to be, but a lot of it you feel and you're intuiting, and you're having to be very receptive and sensitive to the people that you're leading and to the ecosystem, and taking a sense of where things are at, feeling the winds. And I think that just like with any other skill, the more you do it, the better you get at it, the stronger your muscles grow at this task. And I think that this framework, the Leadership on the Line framework, is really a critical one for me, and I would highly recommend others take a look at it.
Thank you. And finally, there are a lot of healthcare professionals that will probably watch this interview or listen to it and think, how can I start into this pathway? What should I do? And you have been an amazing guest speaker in some of the trainings and workshops that People Power Health has organized in the last few years. But is there any particular piece of advice that you will give people that want to get involved into activism?
Start today. I think that for so long, we have as healthcare providers believed this myth that if it's not perfect, we shouldn't get involved, we shouldn't do it. And I think that we often make perfect the enemy of the good.
Yeah.
We are so rooted in perfectionism and getting the A+ that we would rather not get involved than see ourselves author an intervention or a program that is not to our full standard. And I think that because of that perfectionism, I think people die, actually. We just get accustomed and acclimated to, this is just the way things are, this kind of mentality I've seen very often, even in my own residents and in students that I have as mentees. I've seen young would-be change makers become agents of the status quo over time. And I think that the only way that you can fight against that encroachment of the status quo within you is by choosing to resist and fight back in your own small ways. But don't wait until you become that resident and you've graduated medical school. Don't wait until you've become that attending or that professor at some fancy academic medical center. Get started today, because the more you do it, the better you'll get at it. And we need you to be as good as you can if we're going to make this healthcare system better and leave it better than we found it.
Thank you. Thank you very much, Alister, for this conversation. And everyone, please follow us and share this interview with more people, and see you next time.